Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer, here with Lynette Siragusa, Chief Nursing Officer for Shared Health. Today we're announcing 14 additional deaths due to COVID-19. This includes a male in his 50s from the Winnipeg region, a male in his 50s from the Interlake Eastern region, a male in his 70s from the Winnipeg region, a male in his 70s from Southern Health Santé Sud, a female in her 70s from the Winnipeg region and linked to the outbreak at Parkview Place, a female in her 80s from the Winnipeg region and linked to the outbreak at Saul and Clarabelle Simpkin Centre, a female in her 80s from Winnipeg, also linked to the Saul and Clarabelle Simpkin Centre, a female in her 90s from Prairie Mountain Health, linked to Fairview Home outbreak, a male in his 90s from Southern Health Santé Sud, linked to Rest Haven Nursing Home, a male in his 90s from the Winnipeg region, linked to the outbreak at St. Norbert Personal Care Home, a male in his 90s from the Winnipeg region, linked to the Golden Links Lodge, a male in his 90s also linked to the Golden Link Lodge, and a female in her hundreds from Winnipeg region linked to the outbreak at Saul and Clarabelle Simpkin Centre. So just extend our condolences to family and loved ones of these 14 more Manitobans lost to COVID. We continue to announce these deaths every day. We continue to announce higher numbers than what we can sustain. And so I think it's quite clear that we need to continue our efforts to bring these numbers down. We need to stay home to decrease the burden that COVID's placing on Manitoba as well as our healthcare workers and healthcare facilities. As of 9:30 a.m., we have 344 new cases of COVID. Our total lab confirmed cases is at 15,632. The current 5-day test positivity rate is 14.5% provincially, 14.2% in Winnipeg. We're continuing to improve our work in contact tracing. Our contact tracing calls are continuing. We continue to see good results and are reaching cases and contacts in a timely fashion. Public Health has developed a new contact tracing tool, and this is a form that will be available at the testing sites to Manitobans to list their contacts at that time. So this is a form that you can start filling out at the time of being tested. This way there's no delay in starting to recall your contacts. And for those who do end up testing positive, we'll have a record already in place which will expedite further the contact investigation. And so it'll help Manitobans better log or track the people they come into contact with as well. So this will be in circulation as soon as possible. So again, our message has been clear and it's been unwavering, is to stay home. We need Manitobans to stay home as much as possible. You know, this is the only way to ensure we're decreasing our amount of contacts and the only way to ensure we're going to bring these case numbers down. Again, it's not forever, but it's what we need right now. We need to reduce the strain on our healthcare system. So go out only for essentials. Send a minimum amount of people necessary to get those essentials, preferably one if possible. We know, again, weekend is coming up, and so there's always those urges to get together with others or to run non-essential errands. But my ask to you is to stay home. Stay home this weekend. Connect with people virtually, only out for essential reasons. Don't leave the province to go shopping. Don't do any non-essential activities. And for the most part, we're going to stay home this weekend. Certainly buy local and buy online. You can buy over the phone, use curbside pickup. But we can't have any gatherings. That includes faith-based gatherings or any gatherings of that nature. Employers, we continue to ask you to make things easy for employees to work from home if possible. Also make things easy for employees to self-isolate if they're ill or directed to self-isolate, or someone in their household is required to self-isolate. This is the best way that we can get the most amount of people staying home. And so, as we've seen in our numbers, our healthcare system is being pushed to the capacity. Our providers, healthcare providers that have been there for Manitobans right from the beginning, are being overwhelmed. And so we need to step up as Manitobans now to decrease that burden on our healthcare system. Although we don't see the dramatic climb in numbers, we're at a state of numbers that we can't maintain. We're not going to be able to have enough capacity to maintain these numbers for much longer. So we all know what to do, and that's just to stay home, decrease our amount of contacts, and we'll once again start seeing this curve start to flatten. So thanks to everyone, and pass it over to Lynette.
Thank you very much. Good afternoon, everyone. I would like to begin today by thanking the grade 8 students at H.C. Avery Middle School in the Seven Oaks School Division, who are led by their teacher, Caitlin Bartecki. I also want to thank Linda Andre's grade 3 class at Happy Thoughts School in Lord Selkirk School Division. Both these classes this week sent along messages of appreciation and support to healthcare workers in their area. These messages provide a much-needed boost to staff morale at a time when they are feeling stressed and tired and sometimes scared. Knowing their work is appreciated by some of our youngest Manitobans is a great motivator. So I would like to sincerely thank these students for the creative way that they're showing their support for healthcare workers, and please know that we love it very much. Moving on to the system capacity. There are currently 320 people who are hospitalized with COVID today. And as we know, with these ongoing high case count numbers, we can expect that there will be more Manitobans who are going to require in-hospital care. We have to get these COVID numbers to come down so that we can maintain capacity within our healthcare system. And that's not only to manage COVID patients, which we want to be able to do that, but it's also to manage and provide service for all the other health conditions that exist within our system and require our care. As of midnight, our ICUs were operating at 152% of our normal pre-COVID capacity. 46 of the 110 patients in ICU last night have COVID. 32 of the 70 patients on ventilators this morning are COVID positive. We have also postponed 1,136 surgeries in the past month as part of our effort to free up inpatient beds as well as redeploy staff to assist with the ongoing surge related to COVID-19. Also, as part of Manitoba's COVID-19 capacity expansion plan, arrangements have also been made to ensure appropriate care and isolation that are in place for the mental health patients. Phase 1 of the provincial plan had all COVID-19 positive patients who required mental health services to be admitted to the Health Sciences Centre. But as the community transmission is spreading and as the numbers are increasing, the active cases, we have had to move towards what our phase 2 plan is, and that is to open up a 10-bed isolation unit at Selkirk Mental Health Centre, specifically for mental health patients who are COVID positive and medically stable. This unit will work very much in collaboration with Health Science Center Mental Health Program. Patients who are acute, having mental health or any addiction issues, any complex care needs will continue to go to Health Science Center regardless of COVID status, and they will work collaboratively to manage the patient flow based on the needs. Ensuring that appropriate staffing supports are in place is our top priority, and this also includes with our personal care homes. In Prairie Mountain Health, where outbreaks are ongoing in several personal care homes, staff are being redeployed to address the emerging critical needs. In Grandview, this has prompted an temporary suspension of emergency and acute care services at Grandview Hospital, as staff have shifted to support the personal care home. The decision in Grandview was not made easily, but it is essential to ensure that residents are provided with the necessary care in their homes, in the personal care home, whenever possible. As of this morning in Grandview, the PCH outbreak has grown to 15 residents and 2 staff with COVID-19. Emergency response, rapid response team from Swan River was called in last night to assist the staff with monitoring, doing assessments, starting IVs, and whatever help they need, additional help to support the residents. By transitioning the acute care staff to the personal care homes, we are able to provide that additional support that is required with the active COVID cases and more needs in terms of health care. Also, there are requirements to assist with additional cleaning measures, dietary needs, and connecting with the residents' family and loved ones on a daily basis. The care and safety of our clients, our patients, our residents, and our staff is our key priority when making resource decisions such as this and during this unprecedented time. So we want to thank the staff and we want to thank the community for their patience and understanding. While we continue to identify services that can be postponed temporarily in order to meet the COVID demands, it is important for Manitobans to know that services to support their mental health and wellness remain available, especially for emergency situations. So we have the Rapid Access to Addictions Medicine, the RAM clinics, continue to support individuals in need of addiction treatment. The hours of operation and contact information are available on the Shared Health website. The Crisis Response Center continues to provide outpatient services and to respond to the needs of Manitobans who require urgent support. Psychiatrists, peer support, and family support workers are on site, and mobile services are available to provide help in a variety of ways through phone or virtual visits or through community visits, whichever is most appropriate. The child and adolescent mental health assessments are also being provided virtually in many cases, and follow-up and group sessions have moved online where that's appropriate. And our psychiatry and psychology clinical teams are working provincially to establish care models that will allow people to be assessed virtually in their home community so that they don't have to make the trip to Winnipeg unnecessarily. Pandemic exhaustion is very real, and it can exacerbate feelings of anxiety and stress and depression. So we want Manitobans to know that we continue to do everything possible that we can to support these issues, including expanding our virtual appointments. So we are here to help if you need us. And finally, I want to take a moment to thank all the staff who are pitching in to support our personal care homes throughout the province right now. Staff from the home care program, including healthcare aides, health support workers, scheduling clerks, staff development, the COVID-19 response unit, and the nurses, just to name a few, have been taking on additional work and showing up for shifts in the personal care homes. This home care team in Winnipeg is a great example of the selflessness demonstrated by so many of our staff across the system, and we are incredibly grateful for your dedication and for working to balance the needs of both programs, personal care home and home care. I would also just like to make sure the message is out to clients and families who do receive home care to continue to connect regularly with your case coordinator during these extraordinary times. Clients in the community who require essential home care services and who do not have other supports in place to provide that care will continue to receive the services as they require. But if anything changes related to your healthcare needs, please connect with your case coordinator immediately so that they can support you and also provide directions so that you get what you need in a timely and safe way. And with that, I can open up the line to questions.
Thank you. A reminder to our reporters on the line, you will have one this afternoon from CBC Manitoba. Bart.
Hey, Dr. Roussin. In recent days, we're receiving a higher than usual number of complaints about testers that are taking a long time. I've actually heard from almost 9 people who are tested on November 19th alone. Don't have their test results. Some say they've been told their tests are going to Brampton again, and I thought Dynacare was keeping it all in-house. What's the problem with the lab processing right now?
So we're looking into any of these things. I think that we're not seeing widespread issues. Of course, we're doing thousands of tests in a week, so there's going to be some outliers in there. But we're going to look into those specific, and especially on that date, to see what if anything was going on. Like I say, the vast majority of tests are being reported out within 2 to 3 days. When we talk to the lab, some of the reasons for outliers include, incorrect contact information and things of this, but we'll look further into it.
Thank you very much for that. We've been asking about projections for the week, and you had said earlier that your projections initially were looking at a peak in mid-December. If you just do the math, we've had 2,600 new tests in the last week, or new positives in the last week. That turns into 200 hospitalizations and about 25 more ICU patients. Can you please just, based on your superior internal analysis, tell us what the peak ICU and hospitalization number looks like for mid-December?
Right. Yeah. So I sure didn't mean to give the impression of saying that there's evidence that we peak in December, meaning that we start declining after mid-December. That's what we're saying is that we saw in our early projections that mid-December our capacity for ICU beds would be reaching its peak. That's at the prior projections. So of course, those projections were calling for 800 cases a day starting November 22nd, and 1,000 cases a day in the first week of December. And so now we can see that our the restrictions have changed those output looks. So we're going to continue to rerun the modeling over time. But that was at that projection, we were looking at real significant issues with ICU capacity mid-December. Where some of the changes that we've made has affected that. Although capacity right now we're stretched. Every time we expand, we're doing it at the expense of something else in the healthcare system.
From the Canadian Press, Kelly.
Hello, Kelly Malone with the Canadian Press. We've seen investments around mental health services and in regards to shelters, and Syracuse mentioned today, obviously, some of the challenges around moving resources for this. But can you give us a bit more context and insight in what you're seeing in trends when it comes to infections in vulnerable populations?
Yeah, well, so certainly in the Winnipeg area and in the core area, we have seen during the second wave a disproportionate effect in the lower income quintiles, and as well as in populations that are homeless and in shelters. We've seen that both in Winnipeg and in the north. So it is that. A trend that came on fairly early in the second wave and continues to now. And so the issues with that are one is obviously just that it's a disproportionate effect. So we're looking at ways to improve that. The current restrictions have less an effect on people who are homeless or living in poverty, and so we still have to find further ways to help that certain segment.
And are you able to give us a bit more information on enforcement? We've heard the government today about fines for Costco and some other big box stores. Do you have any updates on how many fines have been handed out, in particular for stores like this? As your thoughts on these stores not complying with public health orders?
Yeah, I don't have an update on any of the specifics. I know that was our plan was to increase the amount of enforcement because we know that we're at a critical juncture. We need adherence to this now. And I can't speak to any specific scenario, but it's like what I've mentioned here on a number of occasions, that these orders are in place to save Manitobans' lives. And so, an organization or individuals trying to find ways around it need to understand you're putting Manitobans at risk. And so we said it right from the beginning, even in the first wave. Everyone knows that it's difficult. Everyone knows that pandemics are tough on the economy. They're tough on individuals. They're tough on families. But you can see these numbers, the number of Manitobans that I announce here every day that have lost their lives of COVID. We hear about our healthcare workers being overstretched and overburdened. So trying to find your way around the orders, especially in this short time, this critical time, you're really putting Manitobans at risk.
From CTV Winnipeg, Michelle.
Hello. Why have places that aren't child care centers but operate before and after school programs for kids, including children for essential workers, why have they been told they can't operate?
Yeah, and so again, this is the nature of restrictions. When we write restrictions, write these orders, they have to be black and white, which means there's going to be some things that fall on one side and some things that don't. So this is one in particular that we're looking at to see how ways that we could work in this direction. But a lot of these after-school programs are the very recreation sites that we've found transmission that we wanted to be closed down. So we see the need to have these before and after-school programs. But we also saw that there's increased transmission risk at a lot of the recreation activities that we had in place and that we purposely suspended during this time. So it's that balance. So it is a specific thing that we are looking into still.
Okay. Have there been any discussions with school divisions with the province about a temporary remote learning period after the winter break?
I think I caught that. So we've always been sort of deliberating on what should we do. Should we extend the holiday break? What would it look like? Would it be before? Would it be after? So we haven't landed on a decision on that. And so we're continuing to look at our numbers, and but we haven't landed on a decision on that yet.
From City News, Stephanie.
Hi there. I'm just wondering if you can give us current ICU numbers. I know you mentioned they're operating at 152% of pre-COVID capacity, but what's the current capacity and how many beds are currently full in Winnipeg and in Manitoba?
Just 110. So we have 46 out of 110 patients. So there's 110 patients in ICU, and they're constantly working on building additional capacity for future admissions.
Right, but just a clarification, I was asking how many beds and how many beds are full, not how many are COVID.
Oh. Kevin, what are you saying? Oh, Kevin's saying send him an email.
Okay. Just a follow-up then, the $5,000 fine that was given to Costco and McGilvery, is it enough to deter big box stores like this that can make up that money very quickly from disobeying public health orders?
Well, I mean, it's hard for me to comment on that. I don't determine the size of fines or what level of enforcement occurs. I know there's multiple layers of enforcement that can occur from education to warning to tickets, to health hazard orders to prosecutions under the Public Health Act. So there's a wide range, and so we really got a long way, in the first wave with education and messaging. We're finding in this second wave, despite being here every day telling Manitobans that our ICUs are full, that our capacity is nearing its limits, we just can't, it's difficult to get some people to buy in on just how important it is to adhere to these orders. So, I mean, I think enforcement is they're continuing to look at different venues.
From the Winnipeg Free Press, Danielle.
Hi, good afternoon. Dr. Roussin, in the past, the provincial government has sought a court injunction to break up gatherings that it's deemed unlawful. You may recall the rail blockades that occurred in February of this year. Why hasn't the government pursued this option to stop large gatherings occurring, for example, in the Hanover area that are in contravention of public health orders?
Yeah, I can't really speak to those level of decisions, right? So public health provides advice on what should be restricted, and certainly group sizes of those. We know that from the literature, from our own experience, that prolonged indoor gathering, such as at faith-based gatherings, are high risk for super spreading events. So our advice, and which was taken and put in the orders, that those could not occur. How exactly it's enforced is not really going to be a public health duty to do that.
Okay, thank you. And I just wanted to follow up on some of these projection numbers that you've provided. So earlier in the week, you told us about a potential 800 cases daily by this week. We could have seen that if we hadn't introduced critical level restrictions. So based on your most current and relevant modeling, can you tell us how many daily cases are projected for like the week of December 13th in 2 weeks' time?
No, we still are working on updating those numbers. So I could say that I think it was December 6th, I think we were projecting 1,000 cases a day, under those old models. And so that, we were tracking at the worst case scenario when we put in the red restrictions. So we were tracking as if we had no public health restrictions on and no one was adhering to public health messaging. And so we can see our numbers now, certainly not where we need them to be, but they didn't grow at that same worst case scenario now. We still need to bring these down, and so we're going to continue to work on updating those numbers just to see where we're going to be looking at in the future.
From Global News, Shane.
Good afternoon. Thanks, Dr. Roussin. We're hearing reports of big box retailer in Winnipeg that's, I guess, for Black Friday weekend, that's selling non-essential items, TVs and such, through a drive-through setup in a parking lot with a register set up outside. I'm wondering if that's allowed under public health rules, whether it's a creative way of getting around those, and what kind of risk that might have.
Yeah, and so the curbside pickup, online ordering, remote ordering is allowed, and that includes being able to pay when you pick it up. Our advice is to do most of this remotely. If you can pay remotely and just pick up, then that's allowable. So on a few of these plans we saw that would be ordering on site. That isn't acceptable under the order. The order requires remote ordering, right? So we want to reduce the amount of interaction. So in, pay, pick up, out, not browsing a flyer and interacting with a agent and then placing an order, and then so a lot of the curbside pickup, absolutely, online ordering, absolutely. But then I would also message our overall message, right? Our overall message doesn't change, and that's to stay home as much as possible. So a lot of this is non-essential, and so our message is unwavering. It should be really that we should stay home as much as possible, out only for essential reasons. But this sort of setup, if you have the remote online buying, it's certainly within the scope of the orders, but you can't be placing your order while you're there. It has to be done remotely.
Thanks. So just to be clear, if you're making the phone call in the parking lot for your order, that's not allowed.
Well, again, this now it's becoming such a we're getting into the weeds on this. If you were we don't want long interactions with anyone there. So if you were remotely placing your order, which I would determine on your phone, you're not interacting with anyone while you're placing your order, then that would be allowable. What I would say is that as the orders strictly read, it's remote. And so that's what I would advise people to do.
From the Brandon Sun, Michelle.
Good afternoon. Now we've had a report from a small rural community in the Prairie Mountain region that home care attendants there will be forced to come to Brandon to help at Fairview Personal Care Home. These attendants will apparently be living at a nurse's residence for a period of time. We were told 2 weeks. These same attendants visit actual homes in their small communities rather than facilities. Can you confirm that this is, in fact, part of a new plan? And if yes, how is this protective for those who need home care in those small rural communities?
So I know conversations have been going on with Prairie Mountain Regional Health Authority. And I know that they were trying to find a way to have home care support the personal care home, which is not an unreasonable place to redeploy them, but also just that there's these, as you know, being from Brandon, the travel distances are challenging. So trying to accommodate how to work at a different place and provide accommodations or support the workers' family life and work life. So I think those conversations continue to happen. I haven't received formal confirmation that a decision has been made at this time.
Okay, thank you. I have a question from a reader here. Is why have officials shut down outdoor activities for kids, such as sledding and skating at outdoor ponds, especially if they were sticking to small groups of 2 to 3 kids?
Well, so the outdoor group sizes are 5. So if you were out on a pond with less than 5 people, or going for walks or anything there, we've shut down recreational facilities that are outdoors right now. And just because we wanted to have that decrease the risk of large amount of people gathering, right? If we have an outdoor hockey rink, or do we expect only 5 people to be on it at a time right now? So, so the facilities, outdoor recreation facilities, have been shut down just for the short period, but still there's a lot of outdoor recreation that can occur. The group size limits are 5.
Thank you so much.
From CJOB, Joe.
Hi there. Looking for some more clarity on the school situation. What are the chances schools get moved to level red? We're hearing some divisions are sharing their red plans, and also the chances of extending Christmas break. If we don't have an update, when will we have an update?
Hope to have an update in the near future. I can't really speak to probabilities or anything on it. The red plans, the yellow, orange, and red plans were, to be created in the summer, before school started. I can't speak to what will happen. I can just say we're working on a plan, following our numbers, and hopefully have some messaging early, in the relative near future.
And numbers in the northern region appear to be a little high. Do you know where those cases are coming from?
Varied spots there. There's an outbreak there in Moose Lake is one area seeing a number of cases. The majority of those cases reported today were actually already known positives via the rapid testing. So it's not a lot of new, it doesn't represent a lot of new positives. A lot of it were known positive from rapid testing. We verify all those rapid tests with a lab test to do through the usual process.
From the Winnipeg Sun, Scott.
Hi, good afternoon to both of you. Hospitals closed. People are shuffling from one outbreak to another, or healthcare workers at least. Families are being asked to come and help feed their loved ones in long-term care. Why isn't the military being called in to help, given the staffing shortages, all these, people going from one fire to another fire to try and pull one out? Why not just call in the military for help?
Well, this was part of our strategy, that we knew if we had to expand capacity, we know that outbreaks are part of a pandemic, and this is how we prepared to manage it. And there are absolutely trade-offs. We can't sustain surgery like we used to. We can't sustain home care like we used to in order to manage the COVID situation. So we appreciate that. We're not opposed to having the military come, but I think, really we don't know how bad this is going to be or how long this is going to last. So I think it's one of many strategies that we have available to us, and there's definitely consideration about when is the right time to trigger that if we need it. So I think we still have capacity left to build, and so we'll take it day by day. We'll keep watching these numbers. If they stabilize or decrease, it might not be an issue. If it increases more in certain areas, then that will also dictate where would the military best be positioned to help us. So the conversations are happening more internally now, but certainly it might be an option for our future.
Well, thanks for that. I mean, just a follow-up to that, and I think people have asked this before, but I guess a lot of people, including myself, can't understand why wait. Like, why wait until it's a problem or an out-of-control problem before, I guess why not get ahead of this, knowing that what we've already seen in the last couple months here? Why not just get ahead of it, even if, you don't actually have to use them as much as as possible. But why not just get ahead of the problem instead of catching up to it like it seems like we have been now?
Yeah, well, we have been using external support through the Red Cross. We've been recruiting more. So as much, I mean, it's a good question. I guess it's just the choice we've made so far. When we see these outbreaks, they come and go pretty quickly. Well, I wouldn't say quickly, but they come and go. It's not necessarily that they stay for months on end. So we just, I think, need to be able to manage our resources and prepare for more. And it's a team decision based on incident command, not one person's decision. And the work's still going on to expand capacity within our existing resources. So, but it could be soon. It could be a little while longer. We're just going to continue to monitor the situation and know what all our options are that are available to us.
Thank you.
From CBC Radio Canada, Amelie.
Good afternoon. I wanted to ask you, as talks about COVID vaccine intensify, can you give us an idea of how will it be sent to isolated Indigenous communities? And also, can you ensure that they will have an equal access to the doses, knowing that, for example, some vaccines require big refrigerators?
So this is some of the logistical challenges that we're working on right now. And so we're working on eligibility groups. We're working on, which vaccines can go where. And you're right that when we're talking about remote isolated communities with smaller population sizes, it does become logistically difficult. You have vaccines that are stored at -80, -20, but this is what we have a task force working on right now to be able to determine, how we're going to distribute that vaccine, determine the eligibility criteria, which we work at here at the provincial level as well as nationally. And so there's a lot of work underway on this.
Thank you. I also wanted to ask you, could you tell us what is the R0 in Manitoba? What is the average number of new infections that will be caused by a single infected person when they're sick?
Yeah, so this is, so our what we would call RT, what the current R value or basic reproductive rate is. It's a difficult number to calculate and a lot of variability. So the last that I've seen is around that 1.1, 1.2 mark.
From the Carillon, Josh.
Hi there. I'm in Steinbach. I'm trying to understand very high test positivity numbers. Dr. Roussin, you said last week that there was a 40% test positivity rate in Steinbach based on 30 to 40 daily cases. And I mean, that would indicate to me that there's about 100 daily tests being done. So are we in a situation where if you increase the total number of tests, you could actually have a lower test positivity rate, but still be worse off?
Yeah, it's possible to, if we increase that denominator, that we'll have, a higher absolute case count. We'll pick up on more cases, but then that test positivity could come down. We just don't know that unless it happened. So we know that when you start seeing test positivity rates and that high, it's definite that you're missing a significant proportion of cases. And so they've expanded testing hours there. Despite that, the testing capacity has never been exceeded or is not being exceeded there. So, so we want people to be tested if they're ill, even mildly ill. We want people to be staying home, especially if you're ill, and that whole family self-isolating pending testing result.
And just to understand these high levels of test positivity rates, like they always need to be understood in relation to total daily tests, right?
It is relevant to it, so remember that we're talking about that was a 10-day average of a 40% test rate. So, so if you have one day with, very few tests and you have a high test positivity rate over one day, hard to know what to make of it. But when you see a 40% test positivity rate averaged over 10 days, you can start relying on that there's something significant going on.
Thank you. We have a few moments left for just a couple more questions. Please proceed.
Hey, Ms. Saragusa, as I asked you on Monday and on Wednesday, we have the official number today in ICU of, forgive me, 45 patients. How many more on top of those 45 are long-term ICU patients on ventilators?
So I asked our people who manage the data, and they told me they are working on the recovered number and will get back to me as soon as possible. They want to verify the numbers before reporting.
That's fair. And Dr. Roussin, do you have any update on the Steinbach testing?
Yeah. So they did expand hours this week, and so that's in place now. And from my reports is that this week they haven't been meeting or exceeding their capacity. So there's much more capacity for tests than people showing up for tests.
Great, thank you.
Dr. Roussin, this is Danielle from the Free Press. You said that roughly half of our most recent cases can't be traced to a known transmission chain. When you look at the 0 to 9 and the 10 to 19 age demographic, what portion of those infections can't be traced?
Have that breakdown, have sort of the overall breakdown. So, overall in the province, it's a bit less than the 50. It's in the Winnipeg area, it's about half of the cases we can't link, but I don't have that broken down by age cohort.
Do you think we could get that?
You can look into it. I'll see if they're able to determine that from our FIMS system.
Thank you.
Dr. Ontario schools yesterday.
Sorry.
Go ahead.
Dr. Roussin, this is Tim Ordrani from the Free Press. So you spoke about this just a little bit ago,
What?
but several businesses that have found new loopholes in province-mandated public health orders are doing this drive-through service. I'm wondering if you can explain to us, in this situation where this is a complete shopping experience where they're interacting with sales associates and they can pick through things, is this going to be charged right now? Are they going to be fined for this? What's going to happen here?
Right, so that's the sort of the shopping experience there, interacting with an agent, going through a flyer and then placing orders. That's not what the order allows. Now we're under the impression that the stores that we've been in contact with that approached us with some questions on this were acting in good faith, thinking that this was sort of a remote thing. So we're not going to immediately be issuing fines on that, but we expect that today that's taken care of, that all ordering should be done remotely. Certainly have your curbside pickup, even paying, you're allowed to pay at the area, but all the shopping has to be done remotely. So we expect that to be rectified today.
But on that note, Dr. Roussin, how well do you think retailers are responding to your admonishments ahead of time about not doing things on Black Friday that will bring people to the door? How well do you think they're doing?
Well, I don't know. We're going to have to hear from our enforcement people who are out working hard today, I'm sure, and we'll have to get some of the results on there. But I hope that Manitobans are listening. Remember, there's two sides of this, right? There's the supply and the demand. So no matter what these stores have set up in store for Black Friday, there shouldn't be much of a demand because Manitobans should be staying home and leaving only for essential purposes. So we need all Manitobans to do their part, but we'll get an update, and because like we said, we don't have time for just educating anymore. We need people to know how important this is and to step up now.
Thanks, everyone. This concludes our media briefing.